Hi, in today's video, I am going to tell you about the worst disaster of a clinical trial that I've ever been involved in. Hi, my name is Daniel Regan. I'm the owner of the CRACoach.com, and on this channel, I am talking about tips and tricks and fun stories as today around being a CRA and becoming a CRA. This story is from when I was a contract CRA in Europe. And I had a gig with a company that was looking for a few CRAs to rescue what was left to be salvaged of their study. This study is a great example of the importance of monitoring and timely and high quality monitoring. This was a study that was looking at a viral infection that is rather prevalent in the developed world, and this infection doesn't really cause much of an issue to adults, and I believe, if I recall correctly, about 70% of adults have antibodies, so they've gone through an infection once in their life. They have antibodies, and when they went through the disease, usually it's no more than just a little bit of a cold symptoms. The issue arises when a pregnant woman who has not been exposed to this disease, has no antibodies, becomes infected for the first time in her life. Then this virus can have devastating effects on the unborn child, leading to lifelong disabilities. So this study was trying to figure out what could be done to help these women that have the first infection with this disease while they are pregnant. The concept was to basically give the women antibodies and then they should be fine. So they would be tested and tested regularly, and if they showed any symptoms of infection or antibodies, they would immediately then receive the study treatment, which was a massive dose of antibodies. Now, as I just mentioned, this is a very prevalent disease. So what they were trying to do on this study was you got to catch pregnant women that have the first infection in their lives while they are pregnant. And that was estimated to be about 1 in 100 pregnancies. For this study now, they wanted 80 pregnant women that went through their first infection during pregnancy. And they wanted to test these 80 women against a placebo group of 80 other women. So they needed 160 women that had their first infection during pregnancy. Now, for 1 in 100 women that meet this criteria, you then need 16,000 pregnant women enrolled into this clinical trial. Now, what was the problem that this sponsor had run into? Quite simply, on this study, the study had successfully enrolled 16,000 pregnant women. Now, where do you find 16,000 pregnant women? You need a lot of gynecologists to have access to this amount of patients. And the sponsor had used many gynecologists, over 100 clinics and practices, and a large amount of them, the overwhelming majority, had no experience in clinical trials. They'd never done a clinical trial. And again, we have 16,000 pregnant women that signed informed consent and enrolled into the study at clinics and sites that had no experience with clinical research. Now, the main problem in the management of this trial was that the first CRAs were sent out to monitor anything on this trial after 3 years. Now, to no one's surprise, after they had sent out their first CRAs to those sites to monitor them, those CRAs identified, out of 16,000 enrolled female pregnant patients, over 34,000 findings just on the informed consent forms. Because those sites had no experience in clinical research. They'd never done it before. Apparently they weren't trained sufficiently. And honestly, they apparently didn't really care much about the informed consent form. There were dates missing, signatures missing, no PI signature. There were ICFs with pages missing. Literally any kind of finding you could imagine on an informed consent form was present on this study by the dozens. Now, my involvement myself was not that spectacular on this study. I was just helping them clean up the documentation of all these findings. But this is really a great example of the importance of timely and high quality monitoring. Had they sent out a CRA to the first site that screened the first patient and had monitored them, they would have found those things right away. They could have put it in a newsletter and sent that newsletter out to all of the sites. And then, of course, with all these findings, you send out CRAs to all sites and monitor them right away. But you do not wait 3 years to send out the first CRA. That was literally a prime example of how not to monitor. And unfortunately for this study, it really had a great safety profile for the pregnant women, and it was really looking promising to be a great treatment option for pregnant women. Unfortunately, it was all messed up because of the insufficient monitoring on this study. I have no idea how much money this cost the company, but I know it was a lot. Not even to mention the lost opportunity of this treatment option for pregnant women to protect their unborn children. Okay, so that was literally the most mismanaged clinical trial that I myself have been involved in and worked on. What's your worst catastrophe you've ever experienced or been involved in a clinical trial? I'd love to hear it. If you want to add that in the comments here, that'd be awesome. And as always, here on YouTube, please like and subscribe and hit the bell button so you don't miss out on any new videos I release. Thank you very much. You have a wonderful day, and I will see you in the next video.